Allô, Nissan? Hey, grosse tempête, hein?
Hey, Karine, oui, je sais, les vilains bonhommes de neige sont de retour.
Mais avec le Nissan Rogue à traction intégrale, c'est pas stressant.
Exact, il est conçu et testé pour nos hivers. Oh, Karine, il y a un bonhomme dans le Rogue.
Ah, c'est correct. J'ai allumé les sièges chauffants.
Ah, bien joué, Karine. Maîtrisez toutes les conditions. Louez le Rogue S 2026 à partir de 0,4% jusqu'à 36 mois, incluant une réduction fidélité de 0,5% pour les clients Nissan admissibles. Jusqu'au 2 mars, sur approbation de crédit, les conditions s'appliquent. Détails chez Nissan.
Well, big changes are afoot in the Quebec healthcare system. Of course, it was on Sunday that Sante Quebec came into effect, overseeing the province's healthcare system. And Christian Dubé, the health minister, boy, is he trying, some people would say, blow things up with a new way of doing things. It's going to affect a whole bunch of ways that you receive care. Telemedicine will be affected, and I know more and more people are relying on that. And of course, we also need to talk about the bill tabled yesterday that is going to force doctors that come to Quebec to study to stay here in the public system for 5 years. We now go to Dr. Laura Sang, a family doctor in the Lower Laurentians, who joins us on the line. Dr. Sang, welcome back to the program.
Hi, good morning.
Let's talk first about Sunday and Sante Quebec coming into effect. I mean, I imagine it's just a few days in, maybe too hard to see the effects right now, but why don't we touch on that? What do you think, how does Sante Quebec change the game in Quebec healthcare?
So I think that they were put in place to try to cut healthcare spending and save money wherever they can to reduce the deficit that we know is already present. Some of the changes that I've seen directly were proposed changes to the telemedicine agreement that pretty much they wanted to reduce how much doctors are paid for teleconsultations and distinguish in terms of whether or not they're conducting these teleconsultations from their office versus at home. And they wanted to pay as low as $6.22 for a phone call. And if this offer is not accepted by our federations, they could cut all payment for teleconsultations. Considering that physicians, at least in the GMS, family doctors, pay anywhere from $3,000 to $4,000 a month for rent. Being paid $6 for a consultation is not feasible, and I fear that this could lead to doctors not offering this service anymore, which is a huge disadvantage to patients with reduced mobility, patients that can't drive anymore, that have moved in with family members that are, further away from the clinic, who would need to take days off to bring them in. I know for me personally, with my very vulnerable patient population, that they're very susceptible to respiratory infections. And half the time that I treat them with antibiotics for a pneumonia or a COPD exacerbation, they don't get better right away, and I have to do more intervention. So just being able to call that person and check in on them can make a difference between them, being able to stay at home and be managed as an outpatient versus decompensating and needing to go to the ER.
And just hearing that number, being paid $6 for a telemedicine appointment, it seems so outrageously low. Obviously, you've got overhead and all of these things that you need to pay for. And in getting paid, just over $1 a minute for a phone call does not seem like a way to make a living here. What's the situation now? Like, how much are you being paid for these phone calls?
So we're being paid pretty much what you would get for an in-person visit.
Aha, gotcha.
So it would be a huge decrease. And I know for me personally, about 20% of my practice is via telemedicine. I have one day where I have no patient scheduled. That gives me a chance to fill out their forms, to call back with the normal results, to try to, manage a variety of issues, and having that time available to do so makes a huge difference in my ability to see patients during the other days of the week.
So would you, if this comes into effect, would you just say, not worth it, no more telemedicine? You have to come in if you want to see me. Is that what you'd end up doing?
I've seen a lot of surveys in different, doctor, physician groups talking about how, yes, that's what, pretty much everybody would do. I would definitely start adding more in-person appointments. But, there are still some times where I have no choice but call a person. If I get a critical result that I worry about their safety of staying at home, of course I'm going to call them. Of course, we still have this, legal obligation to attend to urgent results. We're responsible for anything that comes in, and whether or not I'm paid or not. If there's an urgent situation, I have no choice but manage it.
Okay, Dr. Sang, we're with Dr. Laura Sang, a family doctor in the Lower Laurentians. I want to talk about this other bit of news. Quebec tabling this bill that would fine doctors who don't stay in the public system for 5 years after being trained in the province. What are your thoughts on that? The government says, listen, we pay up to almost $800,000 to train a new doctor, and it's unfair if immediately after training that doctor and shelling out hundreds of thousands of dollars over the years that they leave. What do you say to that?
So I think there is a sort of nuance to be made here. That, yes, while I agree that, public funds go into training and that there should be, a certain giving back to the community that supported you through your training, the system that you're working in needs to be functional, safe, and feasible for the people involved. And I think penalizing future medical grads with something like this is a distraction from the underlying issue that the working conditions in the public sector are such that more and more people are leaving. It's not that people don't want to work in the public sector. It's that for a variety of reasons, they're unable to, whether it's because of, strict rules about where they can practice and what activities they have to do, if they have health issues, if they have certain areas of interest or expertise that are not readily available to be practiced in the public sector. There's a whole bunch of factors contributing to this. And, if you look at other provinces, you don't see the same exodus into the private sector out of the province. So you have to ask yourself, what's happening in Quebec that's different from the other provinces that are, making the public system less appealing to work in?
Yeah.
And I think that, a lot of these things are linked, that the more you're putting in restrictions, the more that you're, cutting payment, that you're limiting people's control over their practice, of course, they're going to start looking for, other options. And, I worry if you're putting something like that in, less people are going to study in Quebec and stay here and practice, period. And then we're just going to increase the doctor shortage. And for those that do stay, because those first 5 years are so difficult to adapt, especially as a new physician, I expect we might see more young physicians on burnout, reorienting their practice. So I do worry significantly about the consequences. I mean, the fines that they've proposed for people who would go into the private sector are so staggering, it would make it impossible. And having spoken with more senior colleagues, I worry that, every couple of years they might prolong that kind of agreement. That's what they did with the AMPs when some of my colleagues started. It was 5 years. Then when they hit the 5-year mark, it became 10. Then it became 15. So what's not to say that they say 5 years now and that they might continue to prolong it. So there's a lot of concerns. And I already worry about, trying to cut funding in any way, shape, or form to our healthcare system. I was in a situation last week where I had someone that needed to be transferred to the hospital, and I called for an ambulance, and there were no ambulances available, and we had to find another way to get them to hospital. We are already in a crisis, and, I see a lot of spending elsewhere, and I think that, there needs to be a reorganization of priorities because I don't see where they can safely cut without affecting patient care.
And as I talk to you this morning, and I put these things together. Okay, you're going to force someone; they have to work in the system for 5 years, and they're forced to work in a system that will pay them $6 for a telemedicine appointment. Maybe that's maybe the reason why people don't want to work in the system is because your offer is $6 for a telemedicine appointment. Dr. Sang, listen, we have to leave it there. It's always insightful to talk to you. Thank you so much.
Thank you.
Dr. Laura Sang is a family doctor in the Lower Laurentians.